Hi, everyone that's coming in. Thanks for joining us. We're just letting participants into the room and then we'll get started in a minute. Okay, I'm going to get us started. I think people are still trickling in, but we're at 5 past the hour. Hello, everyone. Welcome. My name is Elisha Dungiorgio. I'm the president and CEO of Global Health Council, and we are really pleased to be co-hosting with the WHO Council on the Economics of Health for All, this second session of Can Economics Help Solve the Climate Crisis and Achieve Health for All? Dialogue with civil society in the lead up to COP27. We had the first session of this last month, and we had an hour. We had a stellar panel presentation and just a little bit of time for dialogue. An hour is never enough. I think we're overly ambitious. So this time we're going to flip that. There's no panel. We'll have short opening remarks and then time to hear from all of you with your questions and comments on this topic, particularly on the statement that the Economics Council provided to heads of state and government in the lead up to COP27. So before we dive into questions, I'd like to turn it to my colleague, Alberto Huitron from the Economics Council for some brief remarks on the first session and also some brief remarks on the Council's statement. So Alberto, over to you.
Thank you very much, Elisha. Good morning and good afternoon from wherever you may be joining from, and members of civil society organizations, colleagues, ladies and gentlemen. The Council on the Economics of Health for All, in partnership with the Global Health Council, is pleased to hold part 2 of a dialogue with civil society organizations in the lead up to COP27. In part 1, a panel of distinguished speakers, as Elisha said, talked about governing innovation for the common good, about the limits of metrics to value what really matters in life, about the relevance of unsiloing the conversation, and about the political economy that led us to the equilibrium where we stand today. Her Excellency Minister Hala Said joined the call, a key organizer of COP27. She provided introductory remarks and stated that health and climate change are intertwined and cannot be thought of independently. The objective of today's dialogue is twofold. First, the Council is interested in listening to civil society organizations as their proximity to people and communities experiencing climate and health adverse effects is vital in shaping collective action. Second, we will take the insights from this conversation and refine the recommendations the Economics Council issued in its COP27 statement released on September 13. The outcome of this conversation will be shared with Her Excellency Minister Hala Said. As a recap, the Economics Council COP27 statement talks about 5 main points. First, we need more and different finance. We need to urgently eliminate fossil fuel subsidies and explicitly target climate funds towards investment in activities that also reduce the environmental determinants of health. We need to increase fiscal space for investment in the common good, especially for low and middle income countries, by rethinking the global financial architecture, including the driving forces of sovereign risk, so that countries that use their debts to invest in mitigation, adaptation, or health are not penalized. And also by using innovative instruments such as debt for health and climate swaps and pandemic clauses. We also need to recognize and address inequality, as the wealthiest 10% of the world are responsible for about 50% of emissions. So we need to tax particular forms of carbon-intensive consumption at very high rates. We also need to foster innovation and technology transfer. international financial institutions should provide the required coordination for comprehensive tech transfer programs, and simultaneously, there must be a strong support for local innovation to develop local solutions. And our fifth point is that we need to move away from GDP-centric short-term policies by rethinking the values that drive public and private decisions and setting the health of humans and the planet as our mission. We also recognize that progress across the 5 points just described will only be achieved and sustained if there is a political commitment to ensure that the green transition is also fair and healthy. It is more important than ever to recognize that progress in climate and health is vulnerable and can easily be dismantled and even reversed if the energy transition and if our economic model are not inclusive. It is essential to reflect on to what extent the current conversation acknowledges the losses the energy transition will bring to relevant sectors of the population, and on how policies can be designed to validate the concern that people whose livelihoods depend on a fossil fuel dependent model and address them by making them part of the solution and not only of the problem. This is crucial if heads of state and government are to build future-proofed agreements to protect the health of the planet. One of the key conclusions from the last conversation is that the underlying political economy of change matters. In the last decades, we have seen increasing waves of polarization that are affecting a myriad of countries. Only this past weekend, 49% of Brazilians who voted in the second round for the presidential election voted for a candidate who has openly implemented policies that contribute to climate change. And the same happened in the US as Donald Trump pulled out from the Paris Agreement, and many countries worldwide are going through similar processes. It would be easy to think these are isolated examples, but it's harder to face the fact that our system is producing such outcomes. And this is the result of a model that sees health as a cost instead of an investment, that concentrates wealth, and does not place the well-being and health of people and the planet as the key drivers for decision-making. Please feel free to comment, share your ideas, experiences, and points of view, and to react to the COP27 statement the Council produced, to the prep document that you all received yesterday, and also to each other. We are looking forward to a fruitful conversation. Thank you very much. And over to you, Elisha.
Thanks, Alberto. Thank you so much for that great summary of the statement and such important points going into COP27. So now we're going to turn to questions. We have some people who have already queued up, and I'll start with that group and take additional questions after we get through the first couple of people. If you have a question, when we get to the second round, you can either use the hand raise function or you can put your question into the chat, and we will hopefully get to everybody. I know, again, an hour is never enough, but I'm going to start with the first in our queue, and that is Molly Moss from the UN Foundation.
Hi, good morning. Thank you, Elisha, and thank you, colleagues from the Council and WHO. Great to hear from you and learn about your work. UNF appreciates that the Council is drawing attention to the climate and health nexus at the upcoming COP. And we read with interest the brief and resonated particularly with the points made on more and different financing for global public goods, including climate mitigation and adaptation, as well as pandemic preparedness and response. To further strengthen the linkage between climate and health in the brief with some concrete examples, the Council may consider referencing the impact of climate change on infectious disease specifically, given compelling new research in this area and the growing attention to One Health paradigm in various conversations in Geneva and beyond. We also noted that household air quality and clean cooking could be points of reference in the brief, given that traditional fuels for cooking drive significant comorbidities among women and children and contribute to ambient air pollution and CO2 rise. Last, we thought that references to adaptation and finance could encourage consideration of long-range health planning, as climate change will impede achievement of UHC. It will tax health systems and result in higher costs of care for non-communicable diseases and others. So just a few points for your consideration, and hope these are helpful, and look forward to the rest of the discussion this morning. Thank you.
Thank you for those comments, Molly. Let's take two more from the first cohort that's queued up. Courtney from Task Force of Global Health.
Hi, good morning, good afternoon, good evening, everyone. This is Courtney Dusenberry with the Task Force for Global Health. We're a non-state actor in Atlanta, Georgia. We want to thank everybody for your work. We think it's very helpful and timely. And a special thanks for setting up this really important discussion. I think bringing together the disciplines around this topic is really important, and we hope that this is going to be the first of many discussions. At the task force, we feel like climate change and its repercussions, the events that are occurring due to climate change, are a public health emergency, and we hope that we can begin to think about it in that way. We also think that public health practitioners should begin to integrate climate change and the responsibility toward climate change into our everyday actions. So thinking about all of our programming and the work that we're doing, adding climate change into that as something that we need to be addressing. And I think a good example of this is the TEPHI-NET network at the task force, which is the network of field epidemiology training programs. We have been having a series of seminars and are going to begin thinking about how to integrate climate change into the curriculum of field epidemiologists being trained around the world. And we feel like this network can be a really good way to start stimulating thinking and innovation as well on the local level. So we are hoping that the brief can include a mention of the need to really call upon existing public health programs and networks to strengthen the effort. Thank you so much.
Thanks, Courtney. Let's Alina from Preventing Pandemics at Their Source.
Hi, I represent Preventing Pandemics at the Source, which is a coalition of leading organizations focused on public health, conservation, human rights science, health justice, and Indigenous rights. I want to start by welcoming your emphasis in your statement on the interlinkages between human health and planetary health. However, I also wanted to emphasize that I think it's important to recognize the interlinkages between climate change and pandemics specifically. And I echo the first statement that was made by, I think, UN Foundation on recognizing the links with emerging infectious diseases. It's important to recognize that climate change and pandemics have common root causes. Each is driven by human encroachment on the natural world, but that also means that they have common solutions, such as acting to protect tropical forests and moving towards more sustainable agricultural practices. This is a win-win for pandemics and climate. It is essential to reach the Paris Agreement goal, and it helps reduce spillover viruses from animals to human. And it's worth noting that spillover is at the origin of all viral pandemics over the past century. Given that this action of protecting forests can help address two of the existential crises we're facing, it's also a very cost-efficient strategy. But to realize its full benefits, funding for forests needs to be targeted in the right way and not only recognize the climate benefits, but also the health benefits of forest conservation. And secondly, the last thing I'll mention is that climate change also makes pandemics more likely. There's a lot more research coming out on this. For instance, in the face of rapid environmental change, survival for many species will mean moving hundreds of kilometers over the next century. And in the process, these species will bring their parasites and pathogens with them in new environments, some populated by humans, which increases the risk of pathogens, spillover, and pandemics as well. Thank you very much for this opportunity.
Thanks, Lena. Appreciate those remarks. We have one more person in the queue, Eleanor Bloomstrom from Women Deliver. Eleanor, over to you.
Hi, thank you so much for giving me the floor today. I really enjoyed the first panel, and I'm happy to have a chance here today. I wanted to specifically appreciate some of the points in the paper in particular around the fiscal space necessity, some of the points on inequality and alternatives to GDP, and calling out the structures of capitalism as some of the systemic drivers of ill health and climate change. And then I did see some gaps in the paper that I think would be really important to address. For example, in terms of addressing the prevention and thinking about primary health care and the link to universal health coverage. And in terms of innovation, I think it's really important to look at the potential unintended consequences of some of the false solutions around carbon capture and storage, and what that could do to human health, to public health. And so working, I think, as the person in the intro said, with people and in communities is absolutely crucial, especially Indigenous people, marginalized communities, and women and girls. And on that point, I believe that all of these papers and all of these actions on climate change have to take a gender perspective. And I found this one to be gender blind. And I think it would be important to add in some aspects around the importance of gender responsive finance, gender responsive action, and one foundation of ensuring that climate change is not having a huge impact on all people is to ensure that sexual and reproductive health and rights are a foundation to all action, and to really bring also in that respect the human rights perspective, which I think could be added to this and make it a much stronger document. Thank you.
Thanks so much, Eleanor. Let's pause for a minute and give Alberto and our other colleague, Dr. Ritu Sadana, some time just to respond to those initial comments. If you have a question or a comment and you'd like to be called on, please raise your hand. I see that we have 1 or 2 hands up already, but after we give a chance for response, we'll turn to the floor. So please raise your hand to get in the queue. Thanks. Alberto, Ritu, do you have any thoughts or comments about all that great feedback you just got?
Yes, of course. Well, first of all, thank you very much, Molly, Courtney, Lena, and Eleanor for your feedback and comments. They are greatly appreciated. We are taking note. We believe that there are many things we could say. We're trying to make a short statement, but some of the things that you said, for example, the nexus between infectious disease and climate change, and the impact of climate change on infectious disease, is something we considered, and it's part of the larger COP27 statement. However, I think we can indeed include a reference to it in this shorter version that we want to policymakers to be able to read, and as COP27 grows nearer, including the attention to the One Health paradigm. As a matter of fact, in one other project that the Council is currently working on regarding antimicrobial resistance, this One Health paradigm and the Global Commons perspective are central pillars to the development of the project. We also appreciate the concrete examples that you've provided as a way to ground our recommendations. And lastly, I would like to say that yes, we will definitely include some reference about the gender perspective. As you know, the Council on Economics of Health for All is formed only by women. And we will definitely include the importance of gender responsive finance and gender responsive action. So for now, thank you very much. Looking forward to other participations.
Ritu, do you want to chime in on anything here?
Sure. Thank you very much. And it's terrific and honored to be part of this conversation. Just to say that the Council, the Economics Council, has proposed a model for reorienting economies for health. And their mandate is to focus on the financial and economic policy levers and mechanisms that can do this reorientation. And the Economics Council is, fully aware that there are other mechanisms as well. But it does recognize that there are root and structural causes. Economics is one of them, but there are also social, cultural, political, other governance issues, as well as the natural environment, which is key into the conversation here. It also recognizes social position of individuals and groups, and that these social positions then, whether it's a person's education, occupation, or gender, ethnicity, these can come together and determine whether people have opportunities or access to services, opportunities given their type of job. If they're in agriculture, if they are working in other sectors or fields which are directly related to climate, the impacts of climate change, for example, that this stratifies people's opportunities. It's actually a drivers of either greater inequality, or it mitigated and managed well could actually be a positive effect. But unfortunately, we usually see the negative side to these not background characteristics. They're things that change the way we have access to resources. There's another area, of course, related to infrastructure and systems that look at financial markets, public and private approaches to provide social protection or pension, and other things related to innovation, as well as sort of the overall health, the way health systems are designed and financed. Because all of these areas come together and interact and impact individuals, households, and communities. And I think the point about the increased cost of services of healthcare is something that adds on, particularly for people who already experience high out-of-pocket expenses, meaning there's no universal system to actually support the financing of health services. And that's very contrary. It's a very direct issue that's contrary to trying to finance for health for all. So we're actually, Alberto and I are here to listen. It's not us. We are not the council. The council is 10 international experts, and we will be providing all of your inputs so we can ensure that the council then issues a statement that reflects the council's views and has incorporated the comments today. And we're thinking of a way actually to even strengthen that, given that these two dialogues have been co-hosted and organized by the Global Health Council. So we're really here in the listening mode. We are not going to exclude any of your options that you propose. Thank you.
Thanks, Ritu. I see we have one hand up, so I'm going to ask Vanessa Carey from SEED to come on and pose your question or make your statement.
Hi, this is Vanessa Carey. I'm the CEO of SEED Global Health, and we partner with governments in sub-Saharan Africa and with the African Union AfriCC to help invest in strengthening healthcare systems and investing in healthcare workforce. So I want to really highlight that there is a really important nexus between, I think, climate, human sustainability and people, and human security. And that if we're not investing in people, we are going to be increasingly vulnerable to the shocks of climate change, and really need to think about what it means to invest in human capacity for resilience, with a particular focus, I would say, on the healthcare workforce, including job creation, which would also therefore touch on gender, because most of these jobs are going to be from, 7% of jobs in the healthcare sector are going to be among women and women. But that there's a deep need, I think, to think about what it means to invest in people as we think about this response. And that is critical to economic growth, to security, and more resilient health systems are going to be better at managing disease outbreaks, providing stability, and then allowing a pathway to good economic growth and investment. And equally, investing in people is the pathway to job creation, to therefore secure households and to individual resilience. And so I think there is an opportunity just to make that very human link as we make some of these policy arguments, and want to thank everybody for leading on this statement and for really helping to flag this connection. And the second point that I would just make is that I think there's an opportunity also to call for creating the positive investment case. I really appreciated, Dr. Sadana, how you noted that we tend to fixate on the negative and the drawbacks, but I think if we can empower policymakers to see where the positive global goods come out of these investments, it will be easier, I think, for them to actually want to make those. They'll be incentivized to then take those pathways forward. Thank you.
Thanks, Vanessa. Just a reminder, if you have questions or comments, please put your hand up and we'll call on you. I have a question now or a comment, and I think we may have other members from WHO and the Council for Economics on the line. So invite all of you to come in and provide your thoughts as well. Just listening to all of these interventions, I think that we often come into this situation as advocates and public health practitioners and climate practitioners, realizing that everything is important. And we don't always prioritize or give a roadmap to what actions to take first or what actions lead to other actions. And so I'm curious from Dr. Sadana or Alberto or anyone else from WHO or the council that wants to come online about how you're thinking beyond this statement about working with governments and providing guidance on sort of what interventions to make first. Or are there things that need to be made first or done simultaneously? I'll pause there, but welcome your thoughts. Ritu, go ahead.
Sure, thank you. So the council is an independent council from WHO, and as they were convened to provide the Director General advice on how to reorient economies for health that's inclusive, hence Health for All, the council is working on a series of recommendations that it will release in May 2023. And as they are an independent council, there will be recommendations they're planning not only to give to Dr. Tedros, but also in terms of the WHO Secretariat. But the report would highlight recommendations for international finance institutions. It would also have recommendations to governments and not only to ministries of health, but also to ministries of finance and economics. And there may be also recommendations at the heads of state level. And also to a range of other stakeholders. And it would be up to these different groups whose recommendations, who the audience is, for them to consider how to actually move this forward, because the council itself is not a policy-making body, but providing this very important thought leadership on one hand, as well as the recommendations and the importance of, as others have already noted, the connection between health and climate and the co-investments and co-benefits are so strong that the council has also made this an important priority. Our chair, Mariana Mazzucato, she will be at COP27 in a few days, And she's also holding a session with several important others there to discuss this connection between economics and health and climate. So there will be also a conversation during COP, and of course, the comments that we receive and have already received will be funneled into that conversation. But I think once the report comes out, we have had many countries that have been interested, and it would be up to those governments who are, we have 194 member states. It would be completely up to them to then determine, would they take another step to engage WHO, for example, to have a stronger mandate on the economic side of looking at reorienting economies to health, which could be, if they choose, a WHO resolution that is proposed, or other mechanisms to influence the way WHO works. This wouldn't come from the Secretariat, but would come from member states themselves. Of course, there's other mechanisms to influence global policy and national policy, and we're hoping that many others would take the recommendations from the Economics Council and use them to make their case as well, whether it's through a mechanism that the UN has established, or through the variety of mechanisms that civil society organizations use to foster accountability and awareness in communities and at the national level.
Great, thank you so much, Ritu. I see we have a couple of hands up, Roberto Duran and Gabine Moses Benge. If you could just state your full name and your organization and the country you're from, I think that would be helpful as you introduce yourself. So Roberto, why don't we start with you?
Thank you very much, Elisha. I am Roberto Duran, a researcher at the WHO Economic Council. One interesting reflection that I would like to share with the audience is about the role of climate change and health, a specific pandemic and pandemic preparedness and response. It's very interesting to see that civil societies and in general private sector acknowledge a straight, at least a clear connection between the two phenomena. Very first at the cause root levels, as one of our colleagues was pointing, the importance of deforestation and zoonotics into pandemic, it's something that is very evident. And also at the level of the solutions, something that has in common climate change and our recent health emergencies is that both are global, truly global emergencies that required some unprecedented level of involvement and capacity from our governments. It's very interesting to notice, for example, that in the financial aspects, the solutions for and proposals for solutions for climate change financing and health emergency financing, pandemic preparedness and response are a common space, and they share very interesting tools that can be applied to the both problems. Something, however, that is very shocking and surprising is that global international organizations, and in particular international financial institutions, saying, for example, global and regional development banks, do not acknowledge explicitly this connection. It might have to do with the internal governance of these institutions, where you have areas and civil servants that are specifically in charge of climate change or health, and these institutions typically are acting in silos, and the dialogue between these areas is broken or has to be stated and connected. So some of the purpose and the ideas of these dialogues and also these documents that the Council is producing is to trigger this kind of dialogue and to and aiming to that these different areas that are connected, but in practice are not having these connections, advance to a more integrated agenda. Thank you to you, and to you, Elisha.
Thank you so much. So now we have a few people in the queue, which is great. I'm going to go first to Kabine, and then I'll go to Maxim, and then Zachary, and then we have another hand up in the chat from Catherine. So Kabine, over to you.
Yeah, thank you very much, Aisha. I'm Kabine from Sierra Leone, West Africa. Climate change as a challenge to health is the issue in terms of growing children, in terms of the development of the country. And now I'm looking at the community perspective. How can we change the ideology of community people to contribute to the development of climate change, like prevention of the cutting down of trees? How can they use their raw materials from the farms and then use it to eat without selling? These are issues that are affecting the children and mostly minorities in most of the, like in our country, one of the 2 districts, children are more stunted because of all these things. Health issue is a big challenge in terms of economic development, because when there is a healthy people, they contribute to the economic development of any state. We are here because we are healthy. And if we are going to leave this stage and other people will continue, is a driving process. So how can we contribute to this? We have to involve all countries. WHO have to involve all participants here because we know our issues. Yes, engaging the direct health facilities is an issue, very important, but at times they always go for the benefits. That is the money WHO is sending. But the WHO have to deal with the CSOs who are working with the people in the community, who are going to the communities. Most of these education funds always stay in the higher folks. They don't go to the community because they feel they marginalize the local people. And we are here because of the local people. So these actually I am recommending to WHO. In implementing this strategy, they have to involve CSOs very seriously, especially we that are in the steering committee, we who are contributing to the nation development. We are not in the field talking to our people, tell them that when you cut one, you plant one. Means when you cut one tree down, you plant another one. Because these are even disturbing how fish can breathe in our water. There is no space. They have cut this importing of timber. These are all factors that are contributing to this. We are not getting the raw materials now as it was when we were kids in our community. So I am advising WHO that in their implementation strategies, let them don't just depend on government strategies. Let them involve people that are matters, people that are going to the communities, because most of these government entities, they will catch up with the finances and then they sit down. They always say more in Africa, we suffer because of that. Mostly corruption is engulfing us in Africa. Because one, we are still under this cash, dealing with liquid cash. These are factors that is affecting us until we move from liquid cash to the electronic system. You know, we have advocated for this system, but the people in authority, like the governor, the bank governors, another finance minister, they can't agree to this because when this IMF come at and they give them the back door something, these are all factors. So they are just self-centered. They don't look at the majority. And the essence of WHO operating is to go down to the most vulnerable people, not only for people who can able to feed themselves. So these are really a good side for us to contribute to this nation development, global development, especially for we in Africa. You know, if we want WHO to succeed, yes, building the steering committee, one important thing. Secondly, you have to work with the steering committee, especially the CSO branch, because we know more what is happening in the community. We know exactly what is happening in our community because we work with them, we sleep with them, and then we do so many things with them. Like people who
Kavine,
most time
Kavine,
go
I'm
to
sorry,
these
I'm gonna have
conferences.
to ask you to wrap up your intervention. I just want to make sure we have time for everyone else that has their hand up.
Yeah. Our intervention, we are engaging because we do this as how you started, is about engaging us to share our ideas. We too have to hold town hall meetings, engage radios, go to community meetings, engage stakeholders in the community for them to understand the essence of WHO, bringing out climate change into their agenda for the health of our children and ourselves. Thank you very much.
Thank you so much. You made some really, really important points there, and I'm sorry I had to stop you. I think the community engagement piece and really the human face of who bears the toll of these decisions is really important and something that we don't always take into account when we're talking about systems and government. So I really appreciate your statement. I'm going to ask Maxim Orizon.
Yeah, thank you. Thank you, Alicia. Thank you, the audience. It's a very interesting discussion. I'm also working at the council as secretariat researcher, and to follow up on the previous speaker, I was wondering, we are wondering actually at the council, we talked a lot about the role of innovation, right, when it comes to health and climate change. And I see here in the chart, there are people from different countries, like from many from Africa, many from India, from Kenya, from all over the world. So perhaps you can share like successful example of local innovation, which is ongoing in your country, right? Which we can use sort of in our work and maybe kind of spread this word, around. So thank you. That's kind of my question.
Thank you, Maxim. I'm going to ask Zachary. I think you had placed a question in the chat, but if you'd like to come off mute and ask. Or if you cannot, I can look for your question in the chat. Maybe it's Zachary, are you able to come off of mute? Maybe not. What Zachary had asked in the chat was, what exactly is WHO doing or committing to in helping countries adapt to climate change, adapt to a changing climate and ensure a more sustainable, resilient and inclusive future for all? And this was actually a question for Dr. Sadana. So maybe we'll take that in 1 second, but we also have Catherine Urbez who has her hand up. Catherine,
thank you very much. Yeah, thank you very much. Thank you for the space. I'm Catherine Urbez from the Global Alliance on Health and Pollution, which is a network of governments, academia, civil society, and international organizations based in Geneva. I would like to highlight the WHO Council statement to take in consideration the death toll of related environmental factors, especially in low middle income countries. And I would like to point out something that you have already raised, which is pollution is responsible for approximately 9 million deaths per year. That what we know, the majority is air pollution, but I would like to call the attention of the WHO Council that chemical pollution is another issue that it has to be in consideration as well when we're talking about pollution as a whole. Another thing that it will be interesting to see, and obviously for further discussion, is the interlinkage of climate change and pollution. I don't think we can treat them as a silos. Due to the burden of disease, the impact to productivity and to the economic, and specifically the most important, the lack of financial mechanism to implement programs to tackle pollution at a national level. Very briefly, within GAP, we work to support national pollution assessment and prioritization mechanism on intervention planning process based on impacts to health. A little bit similar to what is called the mission-oriented policy that is commonly referred within the council. So it is interesting that the council has in consideration the importance to have these collaborative efforts across ministry, civil society, academia and donors, and obviously design these kind of programs to reduce environmental health risk. And obviously this will be with the involvement per se of the most affected one, which is low and middle income countries, and to that recommendations are to increase available resources and monitor process for the implementation of national program. But I would like to finally just highlight how grateful we are to have this kind of conversation and to continue the conversation with the council in order to that these kind of discussions can be reached to a target at a national level. So thank you very much for the opportunity.
Thank you, Catherine. And I see one more question that is in the chat. So I'm going to just read that out, and then we can pause, and Alberto, Dr. Sedana, and anyone who is on from the council would welcome your thoughts and responses to all of these great issues raised. The question in the chat from Nagoni Chibukari is about understanding what WHO is doing on addressing the implications of climate change on access to sexual and reproductive health services, in particular in resource limited settings. So I'll pause there. Alberto, Dr. Sedana, would love to hear your thoughts. I think, Dr. Sedana, there's a couple of questions specifically about what WHO is doing. So maybe we can start with those and then turn more broadly to the comments on the Economics Council statement.
Thank you. I know that in our first dialogue, we had Darmid Campbell-Lindrum, who's the responsible for our work at WHO on climate and health. And he really is the correct person to respond to what WHO is doing. And in terms of very specific questions, such as the one on access to sexual and reproductive health, I really can't, I'm not really aware of the specifics in relation to climate, but we have taken note, and it is something that we know that there's an impact on the access to a wide range of services. And as I mentioned earlier, it can depend very much based on the individual's background and the types of environments that they live in, both the natural environment, but also the governance and political system. So I think what we would like to be able to do is ensure that the council, the Economics Council members have as many ideas from this conversation that can help shape their second statement that will be released either just before or just at the beginning of COP27.
Sorry, I was muted. Alberto, I'm going to turn to you first, just to respond. There's a lot of feedback to take in all at once, and I know we're here to listen, but would love just quick thoughts from you about some of the points raised.
Yes, absolutely. So I think the first point is to say that the council is an independent voice. In this event, we're not speaking for the WHO. This is a council's event, so I will talk about the specific comments related to the COP27 statement and not about WHO's work. And something that I found really interesting and something that we want to dive deeper into is related to Vanessa's comment and also Cabinet's participation about how to strengthen the human link in the climate and health discussion, and also in the way in which international organizations approach these policy issues. One of the things we came across is that, for example, in the US, climate policies have more support if they are framed, if people focus on the health impacts of the climate policies. And we believe that this can be a catalyzer for political support for making important technical changes, such as related to the 5 main points of the Council COP27 statement. So we would like to listen, considering how close civil society organizations are to people, like Cabinet said during his contribution. We would like to listen, how have you been able to focus on this link to increase support for climate and health related policies? Because I think that's at the heart of what we would like to convey in the one pager that we will be releasing during the next days.
Thank you, Alberto. I'd like to just take a minute and invite any members from the council that are on with us today to respond if you'd like to. You can, I think some of you have already come off of mute, but please raise your hand if you're from the council and you'd like to add anything here. Okay, I'm not seeing anybody with hands up or with anybody asking to come off of mute. So I think that I will then turn it back to Dr. Sidana just to wrap us up and talk about next steps.
Well, thanks very much, Elisha, and for everyone who has participated, both in the first and in this round. And we know how important civil society's voices are, and the enabling environment that's important so that civil society can do its work, which is essential to ensure that not only that the agendas are the right agendas for people, but also that those who are empowered to ensure those agendas are put in place are accountable. So we hope that the council will be taking on board as many of your comments and suggestions, and that this would be part of a continuous dialogue. The council will be looking at other topics, and perhaps we can, ensure between now and May 2023 that we can schedule additional dialogues on things that are of interest. So thank you again, and thank you again, Global Health Council, and for all the colleagues who helped put this event together.
Thank you so much, Dr. Sidana. Thank you, Alberto. Thank you, council members, and for everyone who participated today, and for all of the feedback that you provided on the statement and how we can be better on these issues. Looking forward to COP and well, to everything. So really appreciate all of that input, and we will work with the Council on Economics to see about scheduling additional dialogues. Thank you again, everyone. Have a wonderful day.
Thank you.